Stryker Spine is proud to present the new Minimal Access Non-Traumatic Insertion System, MANTIS. This spinal animation video details the key features of the system and demonstrates the surgical procedure for placement of the system. One key feature of the MANTIS system is that it is a true percutaneous system with separate small incisions for each screw placement. No mini-open approach or additional incisions are necessary. The MANTIS system allows for multi-level constructs through these small incisions. The system also allows for precise external sizing and contouring of the rod to match the exact contour and length of the internal screw heads. This surgical animation shows a patient after anterior lumbar interbody fusion at L3-4 and L4-5. The patient is flipped into the prone position and fluoroscopy is brought in for assistance. For each level, the fluoroscope and an external metal instrument are used to locate the rostral caudal entry points. The lead lock needle is then adjusted rostrally or caudally to transect the mid portion of the pedicles, and the skin is marked. This is repeated at the other levels. The medial to lateral entry point will start lateral to the pedicle, but the exact position will depend on the thickness of the subcutaneous fat. The starting point for a thin patient will be more medial than for a thicker patient. Once the starting points on the skin are established, a Jamshidi needle is passed down to the junction of the superior facet and the transverse process. AP fluoroscopy is used to verify that the bony starting point is on the lateral portion of the pedicle, and lateral fluoroscopy can be used to verify that the entry point is directly above the transverse process. The Jamshidi needle is tapped into the bony entry point, and the inner trocar is removed. A K-wire is passed through the Jamshidi needle and tapped into the vertebral body. The Jamshidi needle is removed, and the skin is cut above and below the K-wire to allow passage of the dilators. Serial dilators are then passed over the K-wire to establish access to the pedicle. The threaded dilators are rotated as they pass through the fascia and muscle. The initial blunt dilator is removed, and an awl is used to dilate the bony entry point. The pedicle is then tapped. After the pedicle is tapped, the hollow dilator is removed. To assemble the MANTIS screw, orient the screw so that the tulip is pointing up. Insert the appropriate size retractor blade into each side of the tulip and spread apart. Orient the sliding ring with the flat side down. Insert the retractor blades through the bottom of the sliding ring. Slide the sliding ring past the stops of the retractor blades. Repeat this procedure for each MANTIS screw. Attach the screw retractor assembly to the screwdriver. The screw and retractor assembly is screwed into the pedicle until the screw begins to feel snug. Care must be taken not to drive the screw too far in, as this will limit movement of the screw head along the facet. The screwdriver is held in place by its attachment to the inner threads of the screw. This locking mechanism is unscrewed and the screwdriver is removed. This same procedure is repeated at the other levels. The retractor blades are adjusted so that they are parallel in the rostral caudal direction at each level. The rod contouring shafts are then passed through the retractor blades at each level down to the screw head. The shafts are moved in a rostral caudal direction until they are parallel. The rod contouring linkages are then attached over the rod contouring shafts. In a multi-level construct, the rod contouring linkages are staggered in opposite directions at each level. They are tightened to maintain the shafts in a parallel fashion. The external heads of the shafts now match the same position of the screw heads below. An appropriate sized rod can be measured. It is contoured to fit the external screw heads, which will exactly match the length and contour needed in the screw heads below. The rod contouring linkages and rod contouring shafts are then removed. The rod holder is then used to place the rod into the most cephalad or caudal screw hole and pass to the other levels below the fascia and muscle. After the rod is in place, the blockers are inserted through the counter-torque tube to secure the construct. It is easier to place the nut starting from the most proximal screw to the rod inserter. Repeat the process for additional screws. If compression or distraction is needed, the compression and distraction shaft and hinge are placed over the desired screws with the eyelets facing away from each other. The compressor or distractor is then placed into these holes, and the desired compression or distraction can be performed. Once the correction procedures have been carried out, and the spine is fixed in a satisfactory position, the final tightening of the blocker is done by utilizing the counter-torque tube and the torque wrench. To disassemble the retractor blade assembly, the sliding ring is removed and the retractor blades are collapsed inward and removed. The small percutaneous skin incisions at each level are closed, and we see our final construct followed by a virtual fluoroscopy of our final construct, with a rod that was contoured to fit the construct based on a jig outside of the body.